All right, I'm now excited to introduce our next set of speakers. You heard earlier from Dr. Palacios that she was a member of a committee or a task force anchored to the Health Resources and Services Administration's work. And we're going to now hear from leaders within the Health Resources and Services Administration, also referred to as HRSA for short. I'd like to welcome my two colleagues, Dawn Levinson and Kimberly Sherman, to the main stage. And I want to introduce Dawn Levinson first. Dawn is HRSA's Maternal Child Health Bureau with HRSA's Maternal Child Health Bureau, and more specifically, she serves as Acting Deputy Director, Division of the Healthy Start and Perinatal Services. And she's also serving as an MCHB's, the division's behavioral health lead, providing leadership, coordination, subject matter expertise, and recommendations on behavioral health policy and programs. She's been instrumental in coordinating across HRSA's programs and other health and human services agencies, which has been critical to our work. And she has been the first federal liaison in a federal agency that's championed maternal mental health. And we really want to thank you, Dawn, for being an anchor for years in the maternal mental health space. We're truly grateful. And also her colleague, Kimberly Sherman, who's also been a champion and working along our sides through our fellows program for quite some time. Kimberly serves as the division chief of the maternal and women's health branch at HRSA. And she's been instrumental in leading the division's work around maternal mortality and maternal mortality reduction. And we're so honored and thrilled to have both of you joining us today to share what's happening at HRSA on these fronts. So Dawn and Kimberly, over to you.
Joy, thank you. Thank you so much for those kind remarks. I am thrilled to be here with you all today, and really appreciate the opportunity, and Joy, your tremendous leadership with 2020 Mom and the other outstanding advocates in the maternal mental health space. So thank you. Thanks for having us. We're so glad to be here. So if we can get to the next slide, please. Thank you. So I'm going to start off the presentation with just a little bit of a grounding in the Maternal and Child Health Bureau, and then talk to you today about our maternal health investments. MCHB's mission is to improve the health and well-being of America's mothers, children, and families. And our vision is an America where all mothers, children, and families thrive and reach their full potential. MCHB recently launched a new strategic plan that will guide our work over the next 10 to 15 years. And the plan sets out 4 goals that support our mission to improve the health and well-being of our nation's mother, children, and families. And those are access, equity, capacity, and impact. As an example, I'd like to highlight one of the goals, equity, which focuses on achieving health equity for MCH populations. Here's how we're implementing this goal. We know we need to embed equity throughout the Bureau's programs and investments. This involves moving beyond stating equity as a value and toward action that allows us to be able to gauge progress more concretely. We also need to do internal work to promote diversity, equity, and inclusion within the MCHB organization. We recognize the Bureau plays an important role in national data collection and sharing, and will help us ensure that we're linking our data collection, analysis, and dissemination efforts to our equity goals. At this stage of the strategic plan, we're focusing on the best ways to implement, developing specific strategies, activities, and measures to reach and assess our work on the plan's goals. While we're doing all of this work internally, we know we need to share our plan with our partners, all of you outside of MCHB, so that we can help advance these goals and objectives in the field. We have shared the strategic plan with a variety of stakeholders and are also looking forward to working with our partners, including all of you, as we implement this plan. Next slide, please. In response to the growing maternal health crisis, the Biden-Harris administration launched the White House blueprint for addressing the maternal health crisis. The administration's vision is for a future, their vision for the future is that the United States will be considered the best country in the world to have a baby. The blueprint, using a whole of government approach, includes many MCHB investments that work to reduce maternal mortality and morbidity. The blueprint outlines 5 main priorities to improve maternal health and outcomes in the US. Goal number 1 is to increase access to and coverage of comprehensive, high-quality maternal health services, including behavioral health services. Goal 2 is to ensure those giving birth are heard and are decision makers in accountable systems of care. Goal 3 is to advance data collection, standardization, harmonization, transparency, and research. Goal 4 is to expand and diversify the perinatal workforce. And goal 5 is to strengthen economic and social supports for people before, during, and after pregnancy. MCHB is essential to this effort, with many investments in these focus areas. We're bringing the maternal health blueprint vision to life through a variety of innovative community and state programs. Our programs support pregnant individuals and their families, particularly in communities who are experiencing health inequities. Many of our current programs figure prominently in the blueprint, including some of the following I'll name, and you'll hear more about those as we go along, including doula supplements for the Healthy Start program, which support doulas to provide for a mother's social and physical needs before, during, and after pregnancy. The Screening and Treatment for Maternal Depression and Related Behavioral Disorders program, also referred to as MDRBD. The State Maternal Health Innovation Program, the National Maternal Mental Health Hotline, and the Alliance for Innovation on Maternal Health. If I could get the next slide, please. Wanted to take a few moments to share with all of you some updates with the FY23 appropriations. So with the passage of the FY23 appropriations in December, I'd like to highlight some of MCHB's funding increases for your awareness. MCHB received a $127 million increase compared to FY22. That includes the Title V Maternal and Child Health Block Grant, which received an $87 million increase overall, which included an increase of $25 million to block grants to states, also an increase of $62 million to special projects of regional and national significance, or SPRANs. Of those SPRANs, maternal health investment, I'm highlighting the 3 on this slide. State maternal health innovation grants received $55 million overall. The Maternal Mental Health Hotline received $7 million overall. And a new program, Minority Serving Institutions, received $10 million overall. Next slide, please. This slide shows additional increases, which include the Maternal, Infant, and Early Childhood Home Visiting Program, which received $500 million overall. The AIM program, which received $15.3 million overall. A new program called the Integrated Maternal Health Services Program received $10 million. Healthy Start received $145 million overall. And again, the MDRBD program received $10 million overall. Next slide, please. This slide shows our maternal health programs in the 3 buckets you see here. The first is state systems and innovations. The second bucket is workforce and quality improvement. And the third bucket is direct support and services. So you see some of those programs there that are highlighted in red. We're going to be covering those, plus 2 others that I realized this morning are not highlighted in red. But the programs that you'll hear from us next on are Healthy Start, the MDRBD program, the National Maternal Mental Health Hotline, and then I'll be handing it off to my colleague Kimberly, and she will discuss AIM, the State Maternal Health Innovation Program, the Supporting Maternal Health Innovation Program, which is our technical assistance entity, and then also the Maternal and Infant Health Mapping Tool. Next slide, please. Now, talking about Healthy Start. So the Healthy Start initiative works to improve maternal and infant health before, during, and after pregnancy, and works to reduce racial and ethnic disparities in rates of infant deaths and adverse maternal health outcomes. Healthy Start supports communities where the infant mortality rate is 1.5 times the national average. Local programs enroll women, infants, and children up to 18 months and their partners. Healthy Start grantees conduct a range of activities to improve maternal and infant health outcomes, such as prenatal and postpartum health care, services that increase access to health care, public health services, and provider training. The program began as a demonstration project with 15 grantees in 1991 and has expanded since then to 101 grantees across 35 states, Puerto Rico, and Washington, D.C. Coming soon with new funds in FY23, HRSA will be posting a new Healthy Start Enhanced funding opportunity for a total of $11 million for up to 10 awards. The goal is similar to the Healthy Start program and will provide for direct services, but the enhanced aspect is to develop and implement action plans to advance equity by addressing the unique social and structural determinants of health that contribute to disparities in poor birth outcomes within the project area. And we're expecting that to post toward the end of April. Next slide, please. Now turning to the Screening and Treatment for Maternal Depression and Related Behavioral Disorders program, or MDRBD. This program gives providers the tools to integrate behavioral health services into routine maternal health care. Through this activity, maternal health care providers are trained on how to screen for, assess, treat, and as necessary, refer pregnant and postpartum people with mental health or substance use disorder. Additionally, the maternal health providers are able to receive real-time psychiatric consultations through telehealth services and care coordination support. The current and first ever cohort of 7 states are wrapping up their 5th and final year of this program. Those are the states you see on the slide: Florida, Kansas, Louisiana, Montana, North Carolina, Rhode Island, and Vermont. As you heard me say earlier, with the additional $3.5 million increase in funds in FY23, we're expected to release a new funding opportunity at the end of this month for the 2nd cohort under the new title, Screening and Treatment for Maternal Mental Health and Substance Use Disorders. Funds will be available for up to 14 awards, up to $750,000 per award. Also, eligibility has expanded for this program beyond states to now include tribes and tribal organizations. Next slide, please. So now on to the hotline. Well, I hope that this audience isn't new to hearing about the National Maternal Mental Health Hotline, but if you are, here are some important facts for you. HRSA launched the National Maternal Mental Health Hotline on Mother's Day 2022, so we've been operating just 10 months. Congress authorized this first ever maternal mental health hotline in the Consolidated Appropriations Act of 2021. The hotline provides free, confidential, 24/7 emotional support, resources, and referrals 365 days a year to pregnant and postpartum individuals facing mental health challenges and their loved ones. Professional counselors offer support in English and Spanish via phone and text, so people can get the help they need when they need it. Interpreter services are also available in 60 additional languages, plus a relay service for people who are deaf or hard of hearing. And this really expands access for diverse populations who need this support. Since the hotline was launched in May of last year, hotline counselors have had more than 10,000 conversations, of which approximately 70% were by phone and 30% were by text. I will ask you all, please help us promote this resource to your clients, to healthcare providers, social service providers, community-based providers, friends, and family. Please visit the website at mchb.hrsa.gov to learn more and download materials like printable wallet cards, social media graphics, and newsletter content you can use. These materials are also available in Spanish. Of note, the National Maternal Mental Health Hotline is not a crisis line for individuals in imminent danger of harm to self or others. Counselors can make a warm line transfer to 988 Suicide and Crisis Lifeline, as well as to the National Domestic Violence Hotline and Disaster Distress Hotline when needed. If an individual is in immediate crisis, such as imminent danger of harm to self or others, they should call 911. If they have an immediate mental health crisis, they should contact 988. So at this point, I'm going to hand it over to my colleague, Kimberly Sherman of the Maternal and Women's Health Branch. Thank you.
Thank you, Dawn, and we'll go ahead and move to the next slide. So for the remainder of the presentation, I would love to share a little bit about AIM, the State Maternal Health Innovation, and a few resources similar to the National Maternal Mental Health Hotline. I'll start with AIM. I hope that many of you are aware that AIM is MCHB's central effort to prevent maternal mortality and severe maternal morbidity in the clinical setting. The purpose of this program is to improve maternal health outcomes by working directly with clinical providers, state-based health and public health systems, consumer groups, and key stakeholders like yourselves within a national partnership to assist state-based teams in implementing evidence-based patient safety bundles. These bundles are implemented in the clinical setting in hospitals and birthing facilities throughout the US. Next slide. So as of October 2022, we have 48 states plus the District of Columbia engaged in implementing the AIM program. This represents more than 1,800 birthing facilities across the nation. So as you can see by the map, it highlights current state engagement. We are actively preparing to enroll additional states at this time. In the future, as we prepare for the next funding opportunity for AIM, we are really seeking to expand support to territories and tribal communities. Next slide. I want to just move quickly to the State Maternal Health Innovation Program. This program began in fiscal year 2019 with the goal of improving maternal health outcomes in the United States through a three-pronged approach. We are working to catalyze multidisciplinary collaborations at the state level to really collect and analyze the most recent maternal health data. And then we ask that all awardees implement and execute an innovative maternal health strategy that's aimed at reducing their leading causes of maternal death and severe maternal morbidity. The current cohort of state MHI receive up to $2 million annually. And on the next slide, you'll see those award recipients. Next slide. Thank you. For our first cohort, we funded 9 states. They include Arizona, Illinois, Iowa, Maryland, Montana, New Jersey, North Carolina, Ohio, and Oklahoma. I want to just call out that 2 of the 9 states represented here, the project activities are led by universities, which has been a really interesting model. And we are seeing a number of innovations play out at the state level to include implicit bias training, the development of multi-generational clinics, so where maybe pediatric behavioral health services and that postpartum visit can happen all in one setting to reduce burden. Mobile units are being deployed to make sure that women and their families can receive the services that they need without having to travel miles and miles. May I have the next slide? We've also funded a second cohort of grantees under the State Maternal Health Innovation Program. They're not listed here, but I'll call them out. And please, I want to encourage you to connect with us so that we can link you with the states that are funded under these activities. So our second cohort, which was funded in fiscal year 2022, include Alabama, Arkansas, Colorado, Georgia, Indiana, Maine, Massachusetts, Minnesota, and Tennessee. Of the second cohort, we also have 2 universities in Alabama and Arkansas, and then one foundation in Georgia that are the leads for implementing the state maternal health innovation program. And again, I just want to encourage you to get involved with what's happening around innovating around maternal health in your state. And one way to do that is by partnering with the State Maternal Health Innovation Award recipients. If I could have the next slide. Thank you so much. I want to point you just to two additional resources. So many of you are aware of the National Maternal Mental Health Hotline. I want to make sure that you're aware of the Maternal Health Learning and Innovation Center. The web address is shared on your screen. This is just one resource that we have that provides a plethora of support to states, communities, and organizations that are engaged in improving maternal health outcomes. If you have time to access the Resource Center, I want to direct you to a resource that has catalogs more than 200 maternal health activities that might be of interest to you and your colleagues. The Maternal Health Learning and Innovation Center also hosts our annual National Maternal Health Innovation Symposium, which is happening this year, August 1st through the 3rd in Minneapolis, Minnesota. And it is an open meeting. We encourage you all to, again, check out the website, register to attend, share your knowledge and innovations with other maternal health stakeholders. And then lastly, if I could have the next slide, I want to make sure that you're aware of a recent tool that HRSA published. It's called the Maternal Infant Health Mapping Tool. This is an online tool that explores the relationship between geography and health outcomes. It also helps to identify resources within those communities. This is a tool that's available for public use, and we want to just point you to this so that you can access it and share it with your colleagues. Next slide. A couple of things I want to point out about this tool. First and foremost, we can get down to the county level on maternal and infant health data and also accompanying resources. So some of the things that have been mentioned here in the presentation today, Healthy Start, the State Maternal Health Innovation. If you are interested to see where those resources lie in your community, this tool will help get you that information. The Maternal Infant Health Mapping Tool also helps us to identify need. So area of need, where are there gaps? What additional resources might be beneficial in communities experiencing high rates of infant mortality, just to name a few. So please, please, please do check out this resource that's available to you now. And I just encourage you to connect with HRSA and some of the programs and resources that we have available to this group of individuals who are doing great work to support maternal health outcomes. I think the last few slides are just our contact information, if you wouldn't mind going forward. You can connect with Dawn or myself. Our information is here and also in the app, the WOBA app. So please reach out and let us know if you have any questions or if we can link you with some of the HRSA maternal health investments that are underway. Thank you so much. Joy, I'll turn it back over to you.
Well, thank you, Dawn and Kimberly and MCHB, the Maternal Child Health Bureau of HRSA, for the incredible work and dedication to maternal mental health. It's evident that lots of time and talent and dollars and resources are going into state programs and supporting mothers and providers. So we thank you for your leadership and sharing all of these resources with the community. I'm particularly excited to dig into the new mapping tool that you just shared, Kimberly. So very exciting. We're going to be looking at that mapping tool as well to address whether some of those data points should be included in the new maternal mental health state report cards that we'll be talking about tomorrow. So really exciting work. Thank you again to both of you.